So the etiology of serum sickness, so it can be due to animal protein, say like insulin, a bovine insulin, porcine insulin, the anti-sera which is derived from horse serum. So all these animal proteins can cause serum sickness. Antibody therapies which are derived from animals, horse, sheep or rabbits, and the ATG, anti-thymocyte globulin derived from the rabbit, it is still used in some allograft recipients. So all these are presumed to be the etiologies of serum sickness. So as I have already told you, this is an immune complex mediated hypersensitivity reaction. So all the immune complexes, so the antigen, antibody, they form immune complexes. They go and activate the complement cascade, resulting in neutrophil chemotaxis, lysosomal degranulation, and finally the systemic vasculitis take place. Coming to the clinical features of serum sickness, it is a type 3 hypersensitivity reaction. So it is not an acute one. It does not happen like the type 1 hypersensitivity where the symptoms happen immediately. It happens 7 to 12 days after giving the injections or after administering the infusion. So this has to be told to the patient. So any reaction that they observe after the first week of infusion has to be given back. The feedback has to be given to the doctor. The patient has to come back to the hospital. Very rarely, even after 3 weeks, the patients can get affected with serum sickness. So what is the first symptom that the patient will suffer from? So the site of injection, so wherever the injection was given or the infusion was started, it becomes erythematous and edematous. So site of injection becoming red and swollen. After that, this becomes a systemic reaction. So throughout a generalized urticaria and a generalized morbilliform rashes along with constitutional symptoms, fever, malaise can also occur. Other rashes like petechiae, purpura can also be present. So here we have a patient of serum sickness. So here we can see a lot of urticarial reactions, pruritus, and this will spread on to form a generalized morbilliform rash. So these are other images of serum sickness. So generalized morbilliform rashes. So urticaria starts like urticarias and then becomes generalized morbilliform rashes throughout the body.